Hello and welcome to Talktime, the special broadcast on COVID-19. My guest today is Dr. Naresh Trehan, Chairman and Managing Director of Medanta, the Medicity. He is a world-renowned cardiovascular and cardiothoracic surgeon. Dr. Naresh Trehan, thank you for your time. Welcome to my show.
Thank you. Thank you. I appreciate that.
Pleasure is mine. Dr. Trehan, it is nothing less than a COVID tsunami in India. My question to you, what should be our key strategy to combat this pandemic now?
So, if you look at what the first wave brought to India, this was absolutely unprecedented that we had never known anything about this COVID-19 virus, which was creating havoc around the world. And in our own wisdom, we locked down for 3 months for two reasons. One, to break the chain of this virus spreading, because it was spreading quite rapidly. And the other fact was that we were not prepared medically to handle emergencies of this variety. So those 3 months of hiatus in that lockdown did help to keep the numbers down. And
Right.
it also gave the medical profession the ability to create that infrastructure, also the PPEs, also the masks, also the ventilators that were required in the treatment of COVID-19 patients. Then, of course, then when we came back, the numbers did go up and they went up to as high as 1 lakh per day, sorry. And then it petered off. Now, what happened in that period was we did take care of our people who got sick very well. Our mortality was very low and the percentage of recovery was very high. Because the numbers came down, we got seduced into a feeling that tsunami was actually now on the go and that we will see the end of it soon. So people started actually going out without the caution that we had been giving them all this time
Right.
about masking and distancing and hand hygiene, and many social activities started. Then came Durga Puja, then came Diwali, then came Christmas, and then came Holi. So all these led to a lot of intermixing of people. And simultaneously, the virus, the COVID-19 virus was mutating. And as you heard from UK, that there is a new virus in UK, new mutation, which was actually spreading much faster than the one before.
Right.
And unfortunately, that came to India also because there was such a traffic between UK and India of people traveling to and fro that it came in, and it came in from two centers in Mumbai and Delhi, which is the main hubs of international travel. So when we saw that the second wave was starting, that we did not know that it would go spread with such velocity
Right.
that it will go up to 400,000
Per day.
plus. And the other thing what we find about is, as we experience it is making people sicker. So it is also more virulent, not only spreading faster. So what has happened now is we are in the middle of this crisis where the numbers that have increased to 400,000 plus a day, nobody imagined. That means this all over again, our infrastructure is challenged to a level which was not expected. So there is shortage of oxygen, there is shortage of beds, and other materials also like medicines. So that there is a lot of suffering on the ground of the people because they can't get into hospitals when they need to. They're in a panic,
Right.
and there is also some unethical people who have cornered some of the medicines and started doing black marketing on certain essentials. So this has all come down to the fact that we are now in the middle of a crisis which we need to handle. Now, there are three
Right.
ways that we need to break this. One is the fact that lockdown. Now, lockdown by itself, what is happening today because of the suffering of the last time, the economic suffering, that the central government, in its wisdom, is reluctant to do a national lockdown. But instead, what they have told the states is lockdown where you need to be. Now, Mumbai, as you know, locked down for 3-4
Yeah.
weeks. and we are beginning to see the numbers coming down in Mumbai and Maharashtra. Similarly, Delhi has been in lockdown for 3 weeks, and we are beginning to see the downward trend in Delhi. But because travel is still open to the rest of the country, this is now spreading to the rest of the country also, and
We'll, we'll,
what we are seeing is
we'll talk about that. You spoke about lockdown, Dr. Trehan. Now, is lockdown, do you mean to say that lockdown is yielding results? Is lockdown a good idea, really?
well, I think that what is more important today, if the numbers are raging at the level they are, we absolutely have to break the chain. Now, to break the chain, what are the effective ways? One is to do a limited lockdown that is being happening, but that doesn't prevent it from spreading to other parts of the country because people are traveling. The second is to say, take a national lockdown of a limited duration in the attempt that we break the chain and slow down things. So it should not be the way that we had to do it the first time, like 3 months, but maybe 3 to 4 weeks. I think that would help because without that, it is not seem to be coming under control. Now, if we allow it to spread more and more, then there will be more and more misery around the country, although it may travel from one part to the other, so that the whole country may not suffer at the same time, but there will be
Right.
areas that will have huge problems. And I think, in my opinion, that it would not a bad idea to lock down for 2, 3 weeks, 4 weeks maximum, and break this spread that is happening so rapidly because the nature of this virus, the mutations that have come in, seems
Right.
to be much more virulent.
Now the best antidote everybody is talking about is the vaccine. My question to you, are you in favor of universal vaccination of all our countrymen? How long could it take to have our entire population of 130 crore vaccinated?
Well, there are two parts to vaccination. One is that everybody should require 2 doses. Second is that in the world, there is not enough vaccine. So what the government did, the right thing was, which has been done internationally also, is to go group by group, take the most vulnerable people first. That was the healthcare frontline workers and the elderly. Then it was opened up to lower age group with comorbidities. Then it was open to everybody above the age of 45. And slowly, we were coping with it. So there was enough vaccine. There was some vaccine hesitancy, which seems to have now gone down hugely because of the second wave where people are sensing a huge danger to themselves. And they are also seeing that people who have been vaccinated with 2 doses and enough time has passed for them to develop antibodies, that those people, even if they got infected, have a very mild form. Whereas people who are not vaccinated or only had one shot and they have been caught in the middle, they seem to be getting a very severe reaction. And we have a lot of deaths in those people. And also the second difference in this wave is that a lot of people below the age of 45 are also getting infected and becoming seriously ill.
Right. Right.
So it is true, the only weapon we have right now is to vaccinate. And vaccinate, traditionally, if you look at the wisdom in the medical community, is that to reach herd immunity, 60% to 70% of the people should have been vaccinated. Then the spread slows down by itself. So there are two elements to that. One element is that there are a number of people who have already been infected, who have developed antibodies. They may not need that immunity immediately from the vaccine. They will need it eventually. So
Right.
we may study the antibodies of people who have already had it, and if they have adequate antibodies, we may delay their vaccination and give it to somebody who has no antibodies. That is a very
Right.
complicated strategy and expensive strategy.
Right. Now,
The other strategy is, now that it's been open to 18 years and above, try to get as much vaccine as we can get, either from local manufacturers or internationally. So today we have a production of 7 crore doses a month. hopefully with the introduction of Sputnik, which is the third vaccine, we will go up to 10, 11 very soon, maybe early next month. Now, if we reach about 15 crores of doses a month, we will be able to vaccinate at least the 30 crore people that we need to give 2 doses to as fast
Right.
as possible.
Yeah.
Because that, along with the people who have antibodies already, we may start approaching herd immunity. So that is the other hope. So we need to accelerate. We know that. Vaccinate, vaccinate, vaccinate.
Right.
Wherever we can find the vaccine, and we should do it as fast as possible.
Now, one cause for worry or questions being raised, doctor, is that even after taking 2 vaccine shots, reports of people testing COVID positive are increasing. Now, what could this mean actually?
It was always known that X number of people, when they talk about efficacy of the vaccine, and it goes from 70% to 90%, that X number of those people that means 30% to 10% of the population who has been vaccinated may still get it. But what is the important part is if they get it, they're not hospitalized most of the time. They have a mild one, they can recover at home, and very, very rare death in that group. So vaccine is effective. That is proven now we have 16 crore people who are vaccinated. So now the point comes, what can we do to accelerate vaccination? So I'm saying vaccine hesitancy should be gone from people's mind, because we know that people who were vaccinated and still got infection, which we knew would happen, are not suffering as much as people
Right.
who were not vaccinated. So there is a big difference.
Now, you see, another point I want your opinion is that do you think the vaccines that we are using in India today, that is COVID, Covishield and Covaxin, do you think these vaccines are able to read the new variants of the virus like the ones detected in India and now come to be known as the Indian variant?
We don't know. We really don't know. We don't have enough data to say yes or no. It is very important that we track it very carefully to see whether we have the immunity from these new variants or not. And if we do, how much, or is it playing a major role in the spread today? So there were some studies done in Mumbai and Delhi area, and we found that up to 40% of the new infections in Mumbai were from the UK variant. And about 25 to 30% in Delhi were because of the UK variant. Very few were detected to have double mutation, which the Indian mutation is, or the South African or Brazilian mutation.
Right.
So that's where we are at right now, broadly, as far as the scenario is concerned.
Very quickly, doctor, a lot of people want to know, is there any category of people who should not take the vaccination? For example, is it true that feeding mothers, for instance, is one category of people who should not take the vaccination?
So there were 2 categories which we said. One was lactating mothers who are breastfeeding, and the pregnant women that we did not have enough data. We still don't have enough data in India on that, but the international community has already started vaccinating pregnant women and lactating women. This has already been cleared in America. So we have to do our own studies here a little bit to be comfortable. But the general feeling is that yes, pregnant women and lactating women can be vaccinated, because the risk of vaccine is much, 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 much lower than the risk of getting infection.
So there is no problem in feeding mothers also taking the vaccines?
We don't know that yet. I don't think ICMR has cleared it yet completely.
Right.
But it is certainly under considerations right now, to my best of my knowledge.
Now, Another thing that a very common thing that the people want to know is why is the virus spreading so fast in the second wave? Was it not airborne in the first wave?
Well, if you look at history, and we must learn from it, that the first pandemic that occurred 100 years ago, known as the Spanish flu,
Yeah,
the second wave was much higher than the first wave. And this virus seems to be following the same pattern, that the second wave is 4 times that of the first wave. And then, according to that experience, the third wave will also come. But in the Spanish flu, the third wave was much lower and milder than the second wave. So the second wave is supposed to be more fierce than the first wave, and the third wave is supposed to be less fierce than the first wave. So time will tell. Time will tell, but what we need to do in the meantime is to be prepared for it. I think we are today in a jam because there were too many mistakes made at every level. So the people threw caution to the wind, events happened, weddings started happening, then Kumbh came, and then the election came. So all these things put together have put us in a spot, and I think that this lesson should never be forgotten. And if we go back to personal lockdown, first thing first is personal lockdown, that each person becomes so responsible that they will wear double masks when they go out, they will maintain distance, and they will do hand hygiene as prescribed by us.
right.
Secondly, that we vaccinate as fast as possible. And thirdly, the government should enforce the restrictions very strictly, whether it is required as a full lockdown in one area, or there is night curfew, or there is section 144, whatever it is, it must be enforced properly and prevent people from congregating in crowded spaces.
Now, why, many would like to know, why is the death toll so heavy in the second wave? In Assam, for example, the general explanation is that, well, people are approaching hospitals very late after staying home for a long time and then coming to hospitals only when the complications have increased to an unmanageable level.
Well, I'll tell you, there are many speculations. It is true that there should be a clear signal to the person that it's time to go to the hospital. But who's going to give that signal?
Yeah.
Because a person themselves are not educated enough. So what we have said is, be in the care of a physician. There are physicians available for guidance. There are apps like Medanta has its own app. You can go on that app and you can get connection to us, and we can start you on a home quarantine program. Second, there are governments have put call centers where you can call up the government and get some guidance. So there are parameters which are very clear. If your inflammatory markers, which is the CRP or ferritin or D-dimer or IL-6, these are the 3-4 markers that we look at, are going up, you're getting continuous fever, severe cough. So high temperatures and all that will give us a guidance that yes, this person should go into the hospital. Before we do that, we also do a CT scan, a HRCT, and that also gives us guidance that is the lungs, how badly are the lungs getting affected. Then you can advise somebody, you can be treated at home or you can be treated, you need to go to the hospital. This usually happens between 5, 7, 9, 11 days of the illness. So you should time yourself. The first 5 days is the phase where virus multiplies and you need to get guidance whether you need to go on antiviral medicine.
Yeah.
Then comes the phase when the body reacts and what we call the cytokine phase. And that we would like to control early because some people will go beyond cytokine phase to cytokine storm, and it becomes very difficult to control it at that time, especially in the elderly and people with comorbidities. So there are problems. There are severe problems in people, and we must know that we have to take it seriously and appropriately, that neither go to the hospital too soon nor too late, and take the guidance of a physician.
Well, that's a very important point. You said never go to hospital too soon or too late. Now, you mentioned CT scan to check the condition of the lungs, but there is this debate going on now, for or recommending CT scans or X-rays at the drop of a hat. Many medical experts are saying going for CT scans without a valid reason, just to remove a doubt, perhaps could cost an individual heavy in the long run.
That's true. That's very true. Because you're doing two things. One, you're going too fast, too soon for your chest CT. You will be exposed to equivalent of about 40 chest X-rays, the normal X-rays. So it's quite a high dose. And that the fact is that this dose is cumulative. As if you out later on you need more and more X-ray exposure, then it will all accumulate in your body and can give you cancer. So you have to be careful. Like I said, everything in this whole chain of 14 days has its timing, and everything should be done appropriately. In the first 5-6 days, it's the viral phase where medicines can be used. In the middle, the 7 to 12 days is the vulnerable period for cytokine reaction and cytokine storm. So it must be managed properly.
Right.
And that's what I said. A trained doctor should be guiding you. Not every individual can become an expert on it.
Now, looking back the past 4 to 6 weeks, Dr. Trehan, do you think India was caught by surprise at the intensity of the second wave? If so, why were we caught by surprise?
Because nobody knew. Nobody knew that this new wave is going to go up with such speed and such ferocity. Though so, it surpassed all the estimates. I mean, we have always been thinking that in the first wave also that Indians have been vaccinated with BCG. We have immunity because we are living in unhygienic conditions. Maybe when it gets too hot in the summer, the virus will die. Nothing happened. It has followed the same pattern. So yes, we could have said that maybe the wave would be double of the first wave. Even that we could have handled quite well with the present infrastructure. But the fact it went 4 times, above 4 times, that is the big surprise, and that is why we are in trouble today. And everything should be done to try to control the deficiencies in the system, and we can still take care of our people as we are getting prepared.
Do you think, Dr. Trehan, that the situation is going to be more alarming because COVID seems to be spreading to rural India? In Assam, let me tell you, tea gardens are fast coming under the grip of the pandemic. About 400 to 500 people in the last 2 to 3 days in 2 to 3 tea gardens in the heartland, tea growing area of eastern Assam. They are in the grip of this pandemic. So do you think the scenario could be more alarming?
It is. It is. That's what we are predicting. That it is going to move out from, it started in the west and it's spreading eastward. So it's going to go to the big cities of east also. It's going to, on the way, also spread very widely into the rural areas. And that's where the problem can arise, that for lack of facilities to treat them. So that's where our focus is right now, that we should prepare ourselves for dealing with this as it goes into the hinterland, and we must provide them facilities to be able to treat them. So many measures are being taken. Many have been planned. So they are in the middle of being executed, and hopefully we'll be able to help the rural area as much of help they will need in times to come.
Now, I'll have 1 or 2 more questions. I'll not take much of your time, Dr. Trehan. Now, when do you think the situation in India could peak? And, when is the graph expected to flatten and calm down? Can anyone really predict these things?
It's speculation. Everybody can sound like an expert, but nobody knows the absolute truth. But our estimation is that it will take at least 8 to 12 weeks to be significantly reduced throughout India. Now, it may happen that in places like Mumbai and Delhi, which are the early starters, that in the next month we will see a lot of relief. But as it spreads further, it's going to take a couple of months more for it to try to flatten out. So I think we are in it for a long haul, 2 to 3 months, but things will not be normal for some time to come. And also the fact is that we have to be prepared for the third wave. So as far as people are concerned, their mantra should be the same. They must become mentally fully attached to the three COVID behavior appropriate pattern. Must stick to masking. Even inside the house, you should wear a double layer, triple layer mask so that you don't give it to each other. But if you're going out, you need double masks. You need to stay away from people. You need to wear take sanitizer so that your hands are clean properly, and you wash them 4 or 5 times a day. That is the defense that every Indian needs to do, because we will collectively get into severe trouble if people start being irresponsible.
Right. Now, what does the situation in our national capital, Delhi, reflect in your view, the healthcare scenario? Where do you think we have gone wrong?
Well, the wrong is always comes back to the same question, that it is not an individually who went wrong. Collectively, we went wrong. We did not take this seriously, that the virus is still around and we should be careful, and many events happened which have led to this spread. So now, question is, where are the weak points? The weak points, the main weak point was in this wave is the lack of oxygen, because the demand of oxygen went up 4 times and it is very difficult to get liquid oxygen out of one place and put it to the other without the appropriate trucks, and it takes a long time. So the government has taken many measures to make up for that, but it is slowly going to go into the villages, tier 2, tier 3 cities, and that there may be even a bigger challenge in those places for providing oxygen to everybody. And in the meantime, the manufacture of medicines has gone up, has been ramped up. Vaccines are being ramped up. So our hope is over the 2 to 3 month period that we would vaccinate enough critical mass to be able to say there is some herd immunity in our country, and maybe then the virus will wane over a period of time.
Finally, are you optimistic the world will be able to take control of COVID, and if so, how soon?
So, it is very clear that this whole experience of the last 1.5 years now has created so much havoc around the world, so much misery around the world, so many tragedies around the world, that we have to get over it, otherwise we are in very serious trouble. And to get over it, the world has to act together, and we must be responsible at every level. Like it is said, you're never safe till everybody is safe. So every individual has to remember that. You can't be selfish. You want to keep everybody safe, because you're not safe till everybody is safe. So that's the closing remark I would like to give you, that every person should remember this, that anybody can give you a virus back. So let's work together. Let's try to make it that the whole world can get rid of it. It has happened in the past. It will happen again. But how fast we can do it, with how little morbidity and mortality, that's up to us. That is our challenge, that we, with personal behavior, can actually improve things.
Absolutely. The world has to act together, and every individual has to behave extremely responsibly. That is the message from Dr. Naresh Trehan. Thank you very much indeed for speaking to me on Notice Live. Dr. Naresh Trehan, thank you very much for your time once again.
Thank you. Thank you.